Good morning, warriors. I missed my Monday morning musings. I apologize for that. I was actually on an airplane coming back from hot Houston back to the delightful Midwest. I think I brought some of the Houston humidity with me. I apologize for all my local people, but I missed my Monday morning musings. So here I am to chat with you guys about some of the stuff I learned and some of the first things we're going to roll out at the Lide Center, just because it'll hit so many different areas. I want to talk about PRP, okay? So PRP, platelet-rich plasma, is something that I've been interested in for a while because it helps so many people in terms of how it works, and it's especially good for people that are sensitive. Platelet-rich plasma, it means that we take a certain amount of your blood, and depending on the procedure, the amount of blood will change. So up to 60 mLs. So not a lot, not like a blood, like a full, my level of blood draw with the 28 tubes, or like a full liter of blood, but a significant amount of blood. So you take that amount of blood out. We put it in a centrifuge, and this centrifuge is not your typical LabCorp, Quest, centrifuge. This is a centrifuge that's specifically designed to get the most out of what we're going to do. We spin it down, and depending on your centrifuge, this process takes somewhere between 10 and, at some places called Regenex, it can take up to a couple hours to spin to get the most out of your blood. And what we're trying to do is we're trying to separate your blood cells, your red blood cells, from your platelets. And the platelets are important, platelet-rich plasma, PRP. The reason we want the platelets in the plasma is because that is where the healing is. Platelets form our clots and go to different areas and block things. They also bring with them things for healing. Things like growth factors, things for healing the body. They're going to bring to wherever we put them. Now in your body, they just do it naturally. If there's a trauma, if there's a site of injury, just naturally, that's what our body does. In terms of what we're going to do is we're going to direct them to where we want them to be. So how does this pertain to you? Well, it depends. It depends on what you have going on. If you have pain in a certain area, if you have pain in a couple different areas, if you have a partially torn rotator cuff, if you have an ACL tear, even if you have an acute injury. So say you sprain an area. Basically, by doing this, we're taking out the work of the immune system trying to find where to go, and we are directing it to a certain level. Like an example of this would be you sprain your ankle and you come into my clinic and you say, "Hey doc, what can I do to get back on the grass faster?" An injection. And what you do is you take that platelet-rich plasma that has been spun down and has become a small amount, and you inject it. And you can inject it in a couple different areas. You can inject into the joint if you want to help the joint to heal. If you want to make a tendon, more strengthened, or a ligament more strengthened, you can inject in and around there. If you have a tender spot, you can inject. Now that is not the most economical use because platelet-rich plasma is expensive. Part of the reason it's expensive is the kit for it and the centrifuge are expensive. It's not, like I said, it's not just something you get from your local, LabCorp where the centrifuge is free. Each kit just to make the platelet-rich plasma is like $300. So that's why the injection is so much more expensive. It is used for hair restoration. For people that feel like they're losing their hair, that combined with certain peptides, especially with my moldies and my people that are recovering from mold, platelet-rich plasma is great. It is great for facials. Now you can do it in a couple different ways for facials. You can just apply it, you can do like a microneedling and you can apply it topically. You can do a microneedling. You can apply it in areas. You can use platelet-rich plasma as fillers. And this, for my sensitive patients, is going to be great. It's called a vampire facial. It's called a vampire facial because we're sucking your blood, so to speak. And I have my favorite vampire who's joining me back, Rhonda. She is incredible. So she's our vampire, right? So the vampire facial, We suck the blood out, we spin it down, it becomes active by trauma, and then we inject it into places that you might need filler. Now, this is important. I'm super excited to do it myself because there are areas, that really could benefit, but I don't want to use a filler that my body will reject. The cool thing about this, it's coming from your own body, so your body's not going to reject it. So, joint pain, athletic injuries, chronic injuries, even things like frozen shoulder respond really well to PRP. Chronic overuse injuries, acute injuries, hair loss, facial rejuvenation, whether it be a facial, whether it be an injection for a filler to plump up, whether it be a restoration. These are some of the things PRP can do. And this is something we're going to be doing right from day one. From opening our center, we're going to be doing, topical, joint, all of that good stuff. So wanted to come on because a lot of times, especially my sensitive people, they worry about doing aesthetics. There are ways around that. We can find ways around. If you want to look more youthful, we can find a way to make it happen for you guys. So that's my little plug on PRP today. I'll be sending out an email to all my current patients. If you're not a patient and you want to become one, go ahead and head to my website or give us a call. My website is www.thelidacenter.com. There's a place in the upper right-hand corner where you can book an appointment. Only thing that's important about that is you have to put a credit card on file to do it all virtually. If anything's confusing, don't hesitate to reach out. Our phone number is 920-412-8184. Excited to see you both virtually and in person ASAP. Love you guys. Have a beautiful day. Even though it's rainy, I hope you're enjoying sunshine in your heart and soul. Big hugs, lots of healing.